Mr. President, I come to the floor today to do as I do week after week as a doctor who's practiced medicine in Wyoming, taking care of families from across our state for a quarter of a century, and to give a doctor's second opinion about the health care law. One of the central claims of President Obama and Democrats from Washington who voted here in this Senate chamber was that the health care law would extend insurance coverage for millions of Americans. So that was their goal. They claim that that is actually what has happened. The president claimed repeatedly that 30 million more Americans would receive health coverage because of the health care law. Well, after practicing for 25 years, I understand that there is a huge difference between health coverage and health care. When people have a health insurance card, then they have coverage. When people have access to a doctor or a nurse practitioner or physician assistants, then they can receive health care. The New York Times actually pointed that out this Sunday morning, front page, above the fold. They proclaim in the first paragraph of an article that the president's health care law delivers coverage, but not care. As a matter of fact, Mr. President, when I take a look at this article, Sunday, July 29th, 2012, New York Times, page 1 above the fold, doctor shortage likely to worsen with the health care law. Underneath it says primary care is scarce in bold letters, and beyond that, expanded coverage, but a greater strain on a burdened system. The story highlights a study from the Association of American Medical Colleges, which found that in 2015, just 3 years from now, the country will face a shortage of over 60,000 doctors. By 2025, the shortage is expected to expand to approximately 130,000. So while the nation was already facing this shortage, the article points out that it has been made worse by the president's health care law. The shortage of providers is very important because, as the article states, coverage will not necessarily translate into care. This is especially true for those individuals who are supposed to receive their health care through Medicaid. So remember, a huge expansion of Medicaid was a part of the president's health care law. It was part of the discussion in the Supreme Court, the decision that they came out with. And Medicaid, of course, is the program that provides health care for low-income Americans. You'll recall that the president's health care law contained one of the largest expansions of Medicaid in the program's history. Now, the president chose to expand the program despite the fact that fewer than half of primary care clinicians would accept new Medicaid patients as of 2008. Fewer than half of primary care clinicians were accepting new Medicaid patients. But yet that is where the president chose to build his health care reform from. So say, why is it that so many physicians, primary care physicians, aren't seeing Medicaid patients? Well, it's because the reimbursements provided to doctors are so low that many simply can't afford to see Medicaid patients and continue to keep their doors open. Unfortunately, the outlook for Medicaid really in this country, Mr. President, has not improved. USA Today reported this month, in July, that 13 states are moving to cut Medicaid even further by doing a couple of things. They want to reduce benefits, they want to pay health providers less, or tighten eligibility for the program. So the program that the president highlights as one of the cores of his health care law is already in significant trouble, is not functioning, and is getting worse. So the state of Illinois has imposed a new limit on the number of prescription drugs that a patient can receive who's on Medicaid. This cap was imposed as part of a plan to cut $1.6 billion from the state's Medicaid program. Mark Hireman, a professor at the University of Chicago Law School, told the Chicago Tribune that the prescription drug limits amount to a denial of service. So that's what we're looking at now. And yet this is the basis upon which the president has built his health care law. According to the most recent estimate by the Congressional Budget Office, over 1/3 of the people expected to gain insurance coverage under the president's health care law are supposed to do it through this Medicaid program. Clearly, with states being forced to cut back their existing Medicaid programs, there are many people who are not going to get the care that they were promised through the President's health care law. For those who can find a physician, many of these patients will have to commute longer distances and will also have to endure longer waiting times just to get the treatment that they are seeking. Now, some experts have described this as an invisible problem, and they say that it's because people may still get care, but the process of receiving that care will be more difficult. Now, the chief executive of the California Medical Association says it results in delayed care and higher levels of acuity. I mean, the seriousness of the injury or of the illness to that patient when they finally get the care that they need. So when care is delayed, medical problems can become much more serious, and that forces patients to seek treatment through other settings, and one of the prime examples of that is heading to the emergency room. Well, the whole goal, as I remember the debate here on the Senate floor, listening to my colleagues on the other side of the aisle, is that then patients under the President's health care law, the Democrats claim, would be able to get to see a doctor, a primary care doctor, wouldn't have to go to the emergency room. But that's not what we're finding under the President's health care law. We're finding just the opposite of what the President had promised. That's why the American College of Emergency Physicians told the Wall Street Journal, quote, "While there are provisions in the law to benefit emergency patients, it is clear," they said, "that emergency visits will increase, as we have already seen nationwide." So the President says one thing, the American College of Emergency Physicians is telling you what they are seeing on a daily basis in the emergency rooms across the country. Put another way, since the President's health care law exacerbated the shortage of providers, more patients are seeking treatment in emergency rooms. It's not what the American people were looking for in health reform. So instead of making empty promises, supporters of the health care law should have dealt with the issues that are already causing many doctors to rethink their medical career. For example, supporters of the law absolutely refused to deal with the crushing burden of medical lawsuit abuse. It's an abusive situation that is forcing doctors to practice significant amounts of defensive medicine, which is very expensive. Expensive for patients, individual patients, as well as expensive for the system. The Harvard School of Public Health found that these costs amount to 2.4% of annual health spending in the United States, or $55 billion in 2008. Now, that's the Harvard School of Public Health. There are other estimates out there which go with much higher numbers. Apparently, supporters of the law thought it was more important to help trial lawyers instead of patients. So, as a matter of fact, Howard Dean, the chairman of the Democratic National Committee, has said that they left lawsuit abuse out of the health care law because of the significant impact that the trial lawyers have as contributors to the Democratic Party. So here we are. Additionally, the health care law does nothing to stop the crushing burden of government regulations and paperwork that are consuming the health care profession. Finally, many people choose to become doctors because they enjoy being able to innovate and create the next generation of devices and treatments. Unfortunately, that is changing as a result of the significant taxes that are part of the health care law. In an article published on Friday, we have learned that Cook Medical, which is a medical device company in Indiana, announced that it was scrapping plans to expand because of the President's health care law. And there are similar companies in states all across the country, many with large medical institutions who have a history of the best innovation in the land and actually in the world, but are faced with these medical device taxes, not on profit, but on sales, on the gross amount of money sales. The company said that the 2.3% medical device tax contained in the law would stop the company from opening 5 new plants in the United States and adding approximately 300 new well-paying jobs. Senate should also know that this Cook Medical Company produces medical devices that address women's health issues. Specifically, the company produces products related to gynecologic surgery, obstetrics, and assisted reproduction, just to name a few. So therefore, the President's health care law is actually hurting the ability of Cook Medical and other companies to provide American women with access to cutting-edge medical technology. Why? Because of the device tax, which I believe I believe we should repeal the entire law, but clearly we have introduced legislation to repeal the medical device tax. It is a bipartisan piece of legislation supported from both parties and should be passed immediately. But it does seem that Democrats are reluctant to look at parts of the health care law and repeal the law. It means that medicine is becoming less of an attractive career choice for many young people across the country. And as CNN stated in a headline from July 29th, just 2 days ago, your health care is covered, they said, but who's going to treat you? So the President and Washington Democrats did not seem interested in addressing this question when the health care law was passed, and more effort was putting into hiring IRS agents to look into whether you had insurance than actually to see if there were doctors and nurse practitioners and others, physician assistants, to care for you. So instead of focusing on policies that would give incentives for more people to become health care providers, they filled their law with empty promises that the American people know today have not been kept. It is time for Congress to repeal the President's health care law, replace it with real reforms that will improve the ability of patients to get the care they need from a doctor they choose at lower cost. And that's, Mr. President, why I come to the floor with a doctor's second opinion about a health care law, which, as the New York Times Sunday front page said, doctor shortage likely to worsen with health law, primary care is scarce, expanded coverage but a greater strain on a burdened system. And as I have been saying for a number of years here on the Senate floor, coverage will not necessarily translate into care. Thank you, Mr. President. I yield the floor and note the absence of a quorum.